And don't forget, you can watch us too. We are on your computer, your mobile device. Just head on over to SuperTalk TV. Now, you know that getting good food to good people, to me, is a great thing. And joining us today is Dr. Pam Chatman and Mr. Carl. They've got Food is Medicine initiative in the Delta. They're giving out fresh vegetable food boxes to those that need it, and I can't think of a better thing to do. So welcome.
Hello. Good afternoon.
It's good afternoon. It's good to have you, Carl. Dr. Chatman, are you here with us?
I am here. How are you today?
I am doing well on this beautiful day, and I love that you're extending your efforts there into the Delta to now getting out this fresh and needed vegetable boxes to residents. So I know this was all your idea, or somehow you managed to make this happen. So how did it all come about, Dr. Chatman?
Well, I got a call one day from Mr. Carl, and he said that he had talked with someone and said that I was able and capable to do the job to connect the community and people on the ground with fresh fruits and vegetables, and that they wanted to take this project statewide, and there was no other place they wanted to try it out first than here in the Mississippi Delta. And so we are grateful to have Carl, who's in Diamond Head, and also our national partners who are in California, Project Food Boxes. And this is what they do on a daily basis. And so, Carl can share with you a little bit more on what the plan is for Mississippi.
Well, Carl, I love this idea of bringing more fresh produce to our residents for sure. So how did this come about?
Well, I actually was working on a grant and with Miss Pam before, because I have a charity called Farm Fresh for Mississippi in America, but I was planning on doing it here in Mississippi myself with a grant, but then my buddies out in California already had a Project Food Box going. So I said, well, look, we can introduce that here in Mississippi and expand upon it. And the idea of Project Food Box is that it's actually like food is medicine. So they have a nutritionist on staff that will actually prescribe, like if you got diabetes, if you got renal disease, if you got heart disease, a regimen of fresh fruits and vegetables to treat that. And there's been all kinds of studies that show that eating the right foods and in the right, food is medicine program, you can cut diabetes by 40% and, obesity. We have in Mississippi, we're number one in chronic diseases. So where's a better place to start? And, of course, I grew up in Mississippi, so I wanted to start here.
So how does it work, Carl? And I'm behind you. Anytime you can get more fresh produce or fresh foods that are naturally lower in sodium, naturally loaded and lower in any added sugars, and they are taking the place of those foods that are high in those things, you are going to see an improvement in people's weight and health. That's just as bottom line to it. So how is it going to work? How are you going to choose the people who get the boxes, and then how do we get it to them?
Well, what the normal program is we work through insurance companies, governments, and we set up like a Medicaid or Medicare, and we can deliver the box direct to their house. In California right now, where my buddy started his, they've done 5 million boxes already.
Wow.
So here we do the same thing. We've got to get a platform here to where we've got a group, 300, 400, 500 and keep building on it. But the goal is we spend about, $2 trillion a year in Medicare, Medicaid, SNAP, and VA benefits. It would be good to take a sliver of some of that and actually start trying to treat people before they get sick.
Prevention
is key.
That's
kind of what
key.
the idea of this is we want to start, it's the perfect timing when you've got Make America Healthy Again being pushed by RFK Jr. So this is kind of a vehicle that can get that done with real results, not in years, but in weeks.
And Dr. Chatman, there in the Delta, I think the average Mississippian lives 20-something miles from a grocery store, so access has always been an issue when it comes to getting our most rural and our most vulnerable more fresh foods, right? So it sounds like this is a perfect place for you guys to start this, to get into the hands of those that need it but don't have the access sort of to it. So are you having a hard time finding folks that want fresh food, Dr. Chatman? I know you're not.
We definitely are not. We also have a food program that we're currently doing now mobile distributions in communities. And last week we served over 500 plus people. We had a traffic jam on Highway 61. And so we're actually going to take that mobile distribution on the road to small communities that do not have a grocery store, that is a food desert. We're trying to just help people get back to a healthy lifestyle, even myself, eating fresh fruits and vegetables every day to get healthy. And so I'm excited to have Carl and the partners from California to come down and bring an 18-wheeler full of 600 plus food boxes to give out to the Delta on that day. So we're excited. We are, calling health officials, insurance agencies, and inviting them to a press conference to share with them about this idea. So we're very excited. I'm always excited about helping people in the Mississippi Delta.
What day is that going to be, Dr. Chatman?
That will be Friday. This Friday, coming up Friday, starting at 10 o'clock for the press conference, and the distribution will start at 2 p.m.
So, Carl, will this be a one-time distribution to sort of see how it goes, or is there already set up for those families or those individuals to have another truckload kind of come at a later date?
Well, no, this is a one-time demonstration. We're trying to get people to actually take notice of this. We're actually financing this whole deal ourselves because we want to get it launched. We want people to see how it works. I've talked to politicians in D.C. and in Mississippi State House. Everybody thinks it's a great idea and loves it. Now the only trouble is we got to find a way to finance it so we can keep it going and growing. And that's kind of the idea, is that, it's hard to sell a program by just telling them about it. So if we do a demo there and we have I have a film crew coming so that we can show everybody exactly how this works every step of the way. It'll show you the food boxes, which will come. We'll have like 5 different chronic illnesses that we'll have made up in food boxes for showing what the food box consists of, for treating what, like diabetes or obesity or whatever it is. There's recipes to cook healthy. And there's more to that just than the giveaway, is the fact that once we get this thing up and running, we will actually help local farmers because we want to utilize as much as we can locally. So we're going to partner up with a lot of local farms, so this will give them an avenue for their produce to make a tad bit more money than going on the market and trying to sell it. So we actually hope to develop more jobs and create more excitement for the fact that our farmers will have a place to go.
Well, it's going to be an exciting day in the Delta, Dr. Chatman. I know there's going to be a lot of families and individuals eager to be a part of this and take part of it. But also, the education piece to it. Like this is a real way for prevention works in terms of preventing chronic diseases. I'm all for that, Carl. If people listening are wanting to learn more about it or what you guys do with farm fresh produce in general, Carl, how can they get more information on your organization?
You can go to farmedfresh4ms.org, and that'll give you a little bit of a rundown and stuff. And on Friday, anybody that wants to come out, we'll actually have all the different aspects of it represented with booths to explain from the nutritionist standpoint, from the logistics standpoint, from the packing standpoint, everything. So we'll be able to instruct everybody exactly how this works.
And Dr. Chatman, if they want more information on Boss Lady and how you guys are an integral part in all this, how can they do that?
They can contact me at 662-588-2019.
You a busy lady, Dr. Chatman.
I love to have boots on the ground.
Carl, you reached out to the right lady to get it done there in the Delta. I have no doubt there'll be a huge turnout and it will be a great success. I look forward to seeing the video and seeing how this gets off the ground for you guys.
Thank you, ma'am.
Thank you.
All righty. There you go. Appreciate both of your time and appreciate, man, that effort. And gosh, that's right up my alley, Rhino. When you talk about food as medicine or food boxes, that's one of the things that I really rally behind and believe in. Programs like WIC, which are nutrition prescriptions written directly to the individuals that they serve. And it's shown that, man, it works when you do that. Food is not always medicine. You do need the combination of medicine and good food, but definitely eating better can help us in a lot of different ways. So stick with us. We got more for you coming up next.